So my name's Jane. I'm a senior research fellow in the Faculty of Medicine at the University of Southampton, and I'm an advisor for the RDS. I've been with the RDS for 18 months. I've been involved in research for about the last 10 to 15 years in the Faculty of Medicine. So I'm going to have a look about actually what does make a good question in research. So you just heard from Sophie all about ways that you can access funding and how you can start getting involved in research. But it's where do you start with your research ideas and how do you turn that into something that's potentially fundable and it's something that you can integrate into your practice. So there's a number of elements that you need to consider when developing your question. So this presentation will look at some of these elements and why they might be important to think about when designing your question. We'll also look at how you might come up with an idea, how you can turn that initial idea into a question, and how you can articulate that question and make it easy to understand for funders, but also for the wider community. Oops, sorry, clicked on too quickly there. So your early ideas often originate through your own clinical practice or your own personal experience or your own work environment. So they might be problems that you see every day that you want to address, or it could be through discussions with colleagues or patients. Could be a new therapy or intervention you believe might be effective. You may think of new ways of organising or structuring care pathways. It may be new ways of addressing health inequalities, maybe through public health interventions. It may be from within a current project that you're working with already through your working situation. So I started my academic journey through identifying a gap within a research project that I was working on, and that actually led to funding for a research master's initially, and then on to an NIHR funded PhD. So there are plenty of ways where your research ideas would come from. So talking through your initial ideas with colleagues or reaching out to other researchers and academics is a really valuable thing to do. So likewise, talking through your ideas with us here at the RDS. And I know some of you today are having these one-to-one sessions with advisors this afternoon. So do contact us at an early stage of your research ideas if you're considering applying for some research funding. You will also want to reach out to patients or patient groups, members of the public, to get a wider perspective on your research idea and to see what's important to service users. So your research idea needs to have a wider importance than just your personal interest, and consider this early on in your thoughts about your research. So try and articulate the general aim of your research idea. This will really help in formulating your question. We often think about this in terms of a purpose statement, which is a sort of way of writing down your ideas of what you'd like to do with your research and what you'd like to find out. And one of the most important things is using very simple and straightforward language at this stage, because the easier that you find to articulate it and to describe it to a wider audience, the easier it is to be able to understand it for everybody, and easier for you to be able to explain and justify and apply for funding. There was a link to a worksheet for this session, so it doesn't matter if you haven't got that in front of you, but if you have, that's great. We're just going to take a couple of minutes now just to think about your own research idea, even if it's at really early stages. So just in no more than 3 sentences, just state the general aim of your research. Right, hopefully that's you managed to get a couple of bits down to think about that. So always thinking about your ideas early on is it is really valuable. And even making notes of things as you go through your everyday clinical practice. Somebody said to me early on in my career, when you're in a situation, just keep a little notebook, anything that comes up, any ideas, just jot them down as you go, and you can always refer back to them. And it's not a single process, it's a refining process. Okay, so that worksheet, keep hold of that. You can make notes as we go today, but it's something that maybe we can come back to have a look to see what your original ideas are, and then as we've gone through this, how you might refine that going forward. So we're going to start looking at some of those elements that was on my first slide. So is your idea fundable? So that's you'll need funding for research, one at whether a fellowship or small amounts of funding or a bit of funding for an internship. So we need to look at the research question, and actually, is your idea something that one of the bodies is going to actually invest in you and your project? So you firstly have to think, actually, does it matter? You need to think about whether the research has a wider interest, and if it's relevant. You should be thinking about who's it important to. For example, is it important to patients and service users? Is it important to the NHS? Is it something that's actually going to make a difference? So you would need to think about, does it align with key themes or priorities that these major funding bodies will be looking to support? So the James Lind Alliance is a non-profit initiative that identifies and prioritises unanswered questions or evidence uncertainties. At early stages, do go and look at that. It's a very detailed priorities in there, top 10 priorities of all the different topic areas. So have a look there first, see actually what is the evidence gap, and what is likely to be prioritised for funding. So the NICE also produce guidance documents, and at the end of them they publish 5 recommendations for future research. So that's another place to look. And there are other areas that look at research priorities. It's also depending on the funding stream you're going for. I mean, Sophie was talking about fellowships. If you're looking for more specific funding for funding calls, you also need to check the criteria for the funding stream. Is something that you're interested in doing, does that meet their criteria for the funding call? Is your idea novel? So that seems to be an obvious question, but it is really important to have a look to see what's been done already. That part of that is knowing your topic area, what is already known, what is currently being funded. So there are plenty of places that you can look to see what these funding bodies are actually funding. So there's the NIHR have journal libraries of previous research. They have a whole list of all the awards that have been all the funding awards that have already been allocated. So you can see the topic areas that have been funded, and there's the Cochrane Library as well. So it's important to know what's being funded. It's also very important to know your topic area. What is really known about that? What does the evidence say already? And then you would narrow your focus by asking questions of the evidence. So looking at all the evidence in your topic area, what is not known? What are still the unknowns within there? And that's what we think about as establishing the evidence gap. Because when you develop your research question and you develop your rationale for funding, your application for funding, you need to develop a very clear rationale for your work, so that you need to demonstrate that you really know the evidence and you can identify the evidence gap. Funders will also want to know who will benefit from your research. So is it important? Is it an important topic area for NIHR or for any of the other funding streams? And you can look at that through the priority settings that we talked about earlier. But we need to think about who will benefit. So the number of people who are affected by your topic. So that's the incidence and prevalence of the condition. It doesn't necessarily mean you only research areas that affect large numbers of people. Rare diseases are also important for funders, but it's all about the justification of your application. You need to think about describing your current care pathways or burdens to service users and social care, and thinking about actually how your research would lead to improvements in that. So it's thinking about who will benefit in your research. That's an important part. If you look in your worksheet, there are areas for you to start jotting these types of things down, and thinking about that early is really important for justifying your research going forward. Now, your research question also needs to be specific. It needs to be specific enough that you can answer it thoroughly. However, it's also got to be broad enough that it is not something that could be easily answered with yes, no type questions or data that's already available, or with facts and figures. So it's thinking broadly about it, but it needs to be specific enough that it's going to be an answerable question. And within there also, there needs to be a space for discussion and interpretation. So it's not just yes or no. It is it's more broad in terms enough for inquiry. And is it answerable? So having questions that you might like to answer, but if there's not a way of actually measuring it or answering it, it's going to be something that's going to be difficult to justify and difficult to carry out. So thinking in terms of how your question might be measurable, what sort of methodologies might you use? Would it be qualitative type questions, quantitative? Some questions require a mixed approach of methodologies. So have a think carefully about that when you're developing your question. And what the other thing about how data's collected. So you may develop a question in a way that the data is there, but actually it's going to be difficult to either recruit participants or difficult to collect the data that you will need to answer that question. So think carefully about that when you're developing your research ideas. It also needs to be achievable within your timeframes. So if you develop a question that's going to need really long follow-ups, or really or the scope is too wide, then it may not be achievable. And when you're developing a question and you're applying for funding, funders will be looking to see that what you're suggesting or wanting to do is going to be achievable within the time frame of the funding that you have. And also whether you have the resources to do it, whether this will be carrying things out yourself or whether you need additional resources or support to actually do it. So thinking carefully about that. Excuse me. So those are the main things you'd be thinking about with developing your question. So I thought it might be helpful just to have a look at some of these. So an example of the process that you might go through when you're developing your idea. So this is just an example. So on the NIHR website at the moment, there's going to be a call coming out for children and young people's mental health. So that call hasn't come out yet, so we don't know what that's going to look like. But knowing things and topic areas that are going to be important, it's a good idea, initial idea. It might be an area that you're working in, or we've got certain that's your topic area. So initially you go to perhaps the NICE guidelines and see, are there any research recommendations around this area? You go to the James Lind Alliance what are the main priorities for this? So be armed with what are the things that you want to really be thinking about. And then you would talk to clinical colleagues. Is this a problem? How is this affecting people that you see in practice? What are your overall thoughts and ideas about this? You may talk to other researchers about what are they looking at? What are they thinking about at the moment? What is a priority for them? And talk to young people, children, families that you'll hear about later, doing some patient and public involvement. Your research, that's really important to see what are priorities for the end service users. Then you would consult the literature, identify the gaps in the literature, and then that will be your starting point for developing a research question. So I'm just going to go through a research question here. So this is a hypothetical question. It's not something that's under the research recommendations, but it's just showing you sort of the process that you might go through when developing a question. So you'll first think about your topic area. So as we know, our topic area, children's mental health. Okay, that's a starting point for that. Okay, what your initial idea might be. So you may be interested, for example, in how does social media, the use of social media, how does that affect children's mental health? So that is quite a broad question. So there are unknowns there. So for example, if we deconstruct that, so using, what do we mean by using? Social media, what do we mean? Is that general or specific? We want to be more specific? Children, is that boys, girls, particular age range? Mental health, I mean, that's quite a broad topic. So you would need to be thinking, what do you really want to find out? So we need to refine this question more. So our next iteration of it might be, so what effect does regular use of Instagram? So regular, we've gone from using to regular. We've maybe suggested we're looking at maybe Instagram rather than social media in general. Have on body image and self-esteem. So that might be children's mental health. We've been looking specifically at what part of mental health may be affected through the evidence that you might have reviewed in secondary school children. So we've been a bit more specific there. Is that specific enough? So that will be something to consider. We'll be looking to see now, is that specific? Is it measurable? Is it answerable? And is it fundable? So our next iteration might be even more specific. So what effect does daily use of Instagram have on body image and self-esteem? And then we'd be more specific in adolescent girls, age 11 to 16. So you can see you've crafted that through to something that is more answerable than the initial idea is. So you're now starting to unpack what you're wanting to find out. So developing your research question, you will go through quite a few iterations of it until you really identify what you want to do. But getting something that's specific, measurable and answerable is what you would be aiming for in terms of a research question. You may want to use the PICO format. So your populations that we've identified, your intervention, so in terms of this, so we've got our population of the adolescent girls, we've got our intervention, we'll be thinking about this use of Instagram, and you've got the outcomes we'll be looking at, body image and self-esteem. So we haven't got a comparator in this particular example. So doing it in those terms is quite important. You could, once you developed your research question, you may consider you would need to develop your research aims and objectives, which we're not going to cover today, but research objectives are a way of unpacking what your research question is and how you're going to deliver it. So it's a conceptual and methodological way of how you're going to unpack your research question, your research aims, and how you're going to deliver that. Okay, so I think if you go back to your original research ideas that you jotted down just a little bit earlier on in this presentation, and if you could have a look at that again, and then we would see if you can just spend a couple of minutes just refining that into more of a purpose statement. So you're not needing to, because developing your research question takes time, but look back at what your general aims were, your general three sentences that you're using, and see if you can refine them slightly into some things that are slightly more specific, more measurable, more answerable. Right, hopefully you've had a chance just to think a little bit more clearly about what your research idea might be. So formulating your question, you start with that broad topic, conduct your preliminary research. So knowing your topic area, that's a really thing to do very early on in developing your research ideas. Then narrow your focus and identify a problem that you'll be able to address within the time frame. And then the purpose statement, that you can keep refining to really nail down what you would like to research into. And then you would draft your question. Drafting your question and keep revising it and refining it as you go. As you talk to more people and as you review the evidence, revise your question and make sure it's specific, measurable and answerable. So in summary, what does make a good question? So it does need to be important, it needs to be relevant and evidence-based. So it needs to be novel, so make sure that similar research is not currently being done and that you've identified a gap in the literature and in the evidence that needs addressing. Make sure it's specific and focused enough that you're going to be able to answer it within the time frame of your research. Measurable and answerable. So those are the key things. So go back to the worksheet after the end of today and start looking through those different sections. So I put in that worksheet all of these different things we've covered, and start making some notes of that, and that's something that you can use to refine things going forward.